Okay, so I'm going to show you how to use DURASPHERE, which is our bulking agent for ISD. It's got nice approval and very simple. We've got the product like so. Obviously, I'm not very sterile, sorry about that. And you are using this periurethral, so you go in periurethral instead of transurethral like this. This is why you're going to do this with your scope inside the urethra, and very easily you're going to go in, I usually say 3 areas, and as you go in, the needle, as you move it in, it will be inside. You'll see it inside, and when you inject DURASPHERE, you'll nicely see the sides of the urethra coming together. So for patients who suffer from ISD, this is an excellent solution. Obviously, it will not support the entire mobility for the urethra due to a weak pelvic floor, but it will certainly do the trick when it comes to ISD. The product is one of the few ones that isn't actually going to migrate, nor is it going to be dissolved by the body. It's carbon-coated beads which stay put, and the long-term follow-up is excellent. There's more than 5 years that proves that once the product is in situ, it stays where you put it.